was looking for something that had a good mix of lots of operative volume, lots of surgery, as well as getting good patient care experience and a really high quality education. And I found all of those things here at Beaumont.
The interactions that residents and students have with attendings is something I don't think you find everywhere.
I don't feel like I wake up going to work. I feel like I wake up excited to come to a place where my friends, my family, the people I want to be around are there.
What's very unique about our program is we don't have many fellows, so the residents get to do all the cases, whether they're simple cases or complex cases throughout the residency.
The categorical residents spend a total of 6 years with us. 5 years are spent doing general surgery training, and 1 year is spent doing research or other opportunities.
They get to really become involved with a variety of specialties. That gives them a good breadth of experience in all of general surgery.
Our pledge to anybody training here is that they will be capable of functioning as a general surgeon fully trained at any venue in the United States.
Because Beaumont is a tertiary referral center, we see a lot of complex surgeries that get referred from a lot of smaller community hospitals, and I think that is something that is essential as a learning resident, so you see everything when you're learning.
I love seeing a resident at the beginning just learning how to do these skills, robotic skills or laparoscopic skills or open skills, and how they make progress through those years is my favorite part of teaching.
The number of cases that the residents are involved with and get to perform are pretty extensive, and so they get a very good clinical experience.
A lot of the faculty that are here have been here for a long time. Some of them have even trained here, so they feel a true passion and dedication to the training program and to the residents.
They take it to a different level by trying to really improve the small details in what you do surgically.
And as they progress and their skill level improves and their skill level changes, they're able to have more autonomy in the OR, they're participating in more complex cases.
I think we're in a pretty unique position because this is kind of a hybrid model. It's got academic and community surgeons that both kind of work together in the same model, so we get to see both of those aspects.
We have all the different fields of surgery located within this hospital, so you're really able to get a broad general surgery training.
On top of that, we have top-of-the-line systems in our operating rooms. We have operating rooms that are equipped with robots, with minimally invasive equipment.
The general surgery robotic program here is the fastest growing robotics program and now one of the busiest surgical robotics program in the country.
So the ability to come away as a resident fully trained to do robotic surgery, I think, is an important piece.
We have a robust lecture program that has protected time for the residents every single day of the week.
An important part of surgical residency training is learning facts and learning anatomy and learning physiology and pathophysiology.
From a didactic standpoint, you know, there's definitely your traditional lectures, but I think where we probably excel is that the discussions during our lectures are a lot more of a give and take.
We now have an 8,000 square foot simulation space that is used by different specialties across the hospital.
State-of-the-art facility that allows residents to practice knot tying and suturing and doing complex procedures, putting in chest tubes, all through a simulation experience so that they're ready to do it when they actually have a patient on the table.
Working in the simulation lab allows you to refine techniques and to play with new techniques in a very low-stress way.
We do pig labs with pig livers and gallbladders, stomachs, and that is really hands-on and really simulates human tissue. So you're not learning things for the first time in the operating room.
We learn a lot of different techniques within the lab here and the cadaver lab that we have to translate towards our patients.
There's a really strong emphasis on making sure that above all else the patient is taken care of.
Surgery is a team sport, and it really is lead by example. So we have faculty that support each other in the operating room, and I think the residents see that and emulate that.
We're very proud of the fact that this is a residency that's founded on teamwork and a sense of camaraderie.
I knew this was a place that had a lot of good camaraderie and leadership from the senior residents down.
It's called a residency for a reason. You're here many hours, so it's important for me that I have friends and colleagues that I can rely on, and we can sort of go through this experience together.
It really helps kind of coming to work and feeling happy with the people that you work with. It's not just, oh, it's just my coworker, it's my friend.
We have the lounge that we hang out in a lot of times, so that's a great place to bounce ideas off each other.
Everybody is very friendly, approachable, gets along really well.
The better off you get along with each other and support each other, the better experience you'll have and the better outcomes you'll have for your patients.
And the most important thing in this residency, in our graduates, is that they feel a deep sense of responsibility to those patients and their families.